All right, welcome. Today, we're diving into something that sounds super simple, right? Administering nasal medication. But as you're about to see, there's a huge difference between just getting it done and doing it like a true professional.
So, you probably think giving nose drops is a piece of cake. And yeah, on the surface it seems that way. But what really separates a quick task from a safe professional procedure? Well, it's all in the details. It's about making sure the patient is safe and that the medicine actually works the way it's supposed to, every single time.
And you know what? That professional standard, it doesn't start at the bedside. Nope, it starts way before you even walk into the patient's room. We're going to call this Phase 1, the homework. This is where you lay all the groundwork for safety and success.
Okay, so this checklist is basically your first line of defense. It's what stops medication errors in their tracks. First things first, you've got to know the drug inside and out. What's it for? What are the side effects? Then, you're going to triple-check the MAR, that's the medication administration record, against the original physician's order. And listen, if anything looks even a little bit off, you stop. You get it clarified right then and there. This isn't just about ticking boxes, folks. This is the absolute bedrock of keeping your patients safe.
All right, homework's done, everything's been double-checked. Now we can actually head to the patient. This brings us to Phase 2, the setup. This is all about getting the patient, your supplies, and just the whole space ready to go.
These 4 steps are so important for building trust and keeping things safe. So, step 1, get all your gear together and wash your hands. Basic infection control, right? Step 2, and this is a big one, positively identify your patient. You know the drill. Have them state their full name, check that wristband. Can't be too careful. Step 3 is all about communication. Just walk them through what you're going to do. It really helps calm any nerves. And finally, step 4. Ask them to gently blow their nose. This isn't just being polite. It actually clears the way so the medication can get where it needs to go and do its job.
Okay, prep is complete. Now for the main event, Phase 3, the action. Let's get into the nitty-gritty of the technique.
So the actual procedure here is all about precision. First, get your patient positioned correctly, with their head tilted back. Now here's a key detail. Hold the dropper just above the nostril. You do not want it to touch their nose, because that's a one-way ticket to contamination. And another pro tip, don't just drop it straight down. You want to aim it kind of towards the side, the lateral wall of the nostril. This helps it travel to the right spot. While you're doing this, have them breathe through their mouth. And when you're done, they need to stay in that position for about 5 minutes. That gives the medication time to really get absorbed and start working.
And I have to stop here for a really crucial point. Let's say you draw up a little too much medicine. Whatever you do, do not put the excess back into the main bottle. No way. That's a huge contamination risk. Just dispose of it properly and, of course, finish up by washing your hands.
So, the medication's in, we're done, right? Not so fast. The job's not over yet. Now we get to Phase 4, the follow-through. This is all about aftercare and documentation, which is what really completes that circle of care.
Documentation, as we all know, is non-negotiable. It's super straightforward. If everything goes to plan, just chart the dose, the time, and you're good. But what happens if the patient refuses? You can't just skip it. You have to document that refusal, and, this is key, you have to write down the reason they gave you. That creates a complete medical and, frankly, legal record.
This brings us to a really important idea in patient care, something called the expected effect window. And look, this isn't just some random amount of time you wait. It's a very specific period when you need to go back and check on your patient to see how they're responding to the meds.
So, how long is this window we're talking about? Well, a pretty standard time frame is about 30 minutes. That's your cue to go back and see how they're doing. Are their symptoms getting any better? Are they having any side effects? This follow-up assessment is absolutely vital. And if anything seems off, if they're not responding the way you'd expect, you report that to the physician right away.
So, let's recap. We've covered the prep, the action, the documentation. The procedure is for all intents and purposes complete. But think about it. What's that one final step that takes this whole thing from just being a task on a checklist to being true patient care? It's that follow-up, right? That assessment. That's the moment you close the loop and confirm that what you did actually helped. And that, right there, is what it's all about.